Hi, everyone. Thanks for joining us today. I'm sorry we're a few minutes late. We realized there was some technical difficulties regarding the access code, so we still have some of our presenters today calling in, but I think we have enough of a critical mass to go forward. So thanks for joining. My name is Nicole Bahina, and I'm with All Chicago, and I'm going to be moderating the presentation today, but you'll be hearing from partners from DFSS and CDPH, as well as some people who lead coordinated entry. And so we'll try to have people introduce themselves as we go throughout today. So everyone's muted, and we're using the questions tool to submit questions. So those come to me and then I can assign them out. We'll pause throughout the presentation to make sure that we have time to address those. If you're having any audio issues, hopefully you could hear me say this, but you just can navigate to the audio section of the GoToWebinar panel. Usually it's on the left-hand side of your screen, and kind of toggle back and forth between different types of audio or get the access code from there. So today's agenda, we're just going to do a quick reminder about the webinar format and schedule. Then we'll have a current status update about COVID-19 in Chicago. We'll hear from some people from CDPH to talk about shelter testing and flu vaccines. DFSS will give an update, and then I'll talk through some expedited housing initiative things. And then there's a pretty robust announcements section at the end. So if you can stay on, and we'll try to stay on time so we don't keep you over, but if you can stay on, I think some of the announcements at the end will be really helpful for people. If you're not able to stay on, just make sure you grab the PowerPoint, which we usually post by Monday at the latest, from Slack or on our website, because those announcements are critical, and we'll try to reiterate those announcements in our communications that go out to the COC as well. So about the webinar schedule, we used to alternate this webinar with peer sharing webinars, and we just want to remind people that we have transitioned the peer sharing webinars into a work group format, and we are doing those. And if you're interested, you can contact Torlin about participating in those peer sharing work group meetings. And we're continuing with these webinars jointly on behalf of All Chicago and CDPH and DFSS in a monthly format. So make sure you register for the next monthly webinar, and we can drop the link for doing that in the chat, or you can grab it from the slides, which we'll send out afterwards. Great, and with that, I'm going to turn it over to Divya, who's going to walk us through the next couple of slides.
Hello, my name is Divya, and I am a communicable disease control investigator at CDCI with CDPH. And I've also included the name and contact information of Andrew. He's another CDCI. And our role is to do a proactive outreach with shelters and to provide update for prevention and early detection of COVID-19 cases. We've also been calling the shelters to establish an ongoing relationship to share new city guidelines, to identify new COVID-19 cases, and help provide testing. So today I will be the one providing updates from the CDPH end with guidelines and reminders. So let's get started. Next slide, please. So I wanted to start it off with a quick COVID-19 status update. There are 75,840 cases of COVID-19 and 2,923 deaths among the Chicago residents as of September 16th of 2020. And an estimated 69,728 residents have recovered from COVID-19. The graph on the left shows that the confirmed daily cases have gone down overall. But again, our goal is to lower this number as much as possible. And we want to prevent another spike again, especially during this upcoming winter time. The figure on the right shows that the percent positivity of the COVID-19 tests have also decreased in Chicago. Next slide, please. And this is some information regarding the rates of positivity in the shelters. So this slide shows that the percent of positivity graph for testing at shelters from April to the current testing block, which is through September 5th. And it's a pretty good overview of how far we've come to mitigate transmission among the shelter population within the last 6 months or so. And our data shows that on average, the percent of people who test positive for COVID-19 within the shelter programs have decreased over time. That means that we're likely seeing a lower rate of spread within the shelters, which is great, and we're preventing large outbreaks of COVID-19. And to summarize this graph, for the past 20 weeks, the Chicago's percent positivity rate in shelters with at least one reported case have been well below 15%. And we hope to see that this percent positivity will decrease over time in the future as well. Next slide. Okay, so I wanted to update you all on some important reminders and guidelines. For housing providers, so CDPH does not routinely require or recommend a COVID test or a 14-day quarantine for new intakes into the shelter system. So I wanted to give you more of a reasoning of why we don't recommend a testing on intake or a 14-day quarantine for new intakes. So this is because the virus can be introduced by any staff or resident that's leaving or returning from the facility on a daily basis. So for instance, either for work, for shopping, or any other activities. So it's just not practical to test every one of these groups every time they come into the facility. Also, a negative test is no guarantee that someone does not have the virus. This is because you can be infected with the virus and it might not show up on the test for a few days. Additionally, the CDPH does not require or recommend testing to determine when someone who has been diagnosed with COVID-19 is no longer required for isolation or work exclusion. We recommend that you follow the CDC's symptom-based strategy to discontinue the isolation. So that is, we recommend that isolation is maintained for at least 10 days after the symptom onset or the date tested, and at least 3 days after recovery. So that means the shelter staff can return to work and the residents can resume their normal activities without further testing if these conditions are met. Other reminders for staff members: please stay home if you're sick, don't come to work, and get tested by your healthcare provider or at a city-run testing site. And if a shelter has a point prevalence survey, that's a PPS, that's scheduled due to a known COVID case or cases, the group activities and external programming has to be temporarily suspended until that PPS results are completed and known to be negative. And then another reminder is that the CDPH's priority groups for testing, these are for people with a rapid test machine, or if we're testing via the CDPH's testing team, please only test individuals that have symptoms, even if they're mild symptoms, and individuals that with known or suspected exposure to someone with COVID. So that's regardless of symptom. Next slide, please. And here are some more guidelines for early detection, isolation, and reporting for people that have COVID-19. So instead of testing at intake, we recommend that you screen residents for symptoms and check for temperature regularly, ideally every day or every time they enter the facility, but at least 2 to 3 times per week. And please click on the blue link to access the CDC's website that lists the symptoms to screen for. And as a quick note, new symptoms have been added to the CDC's list, so it's important that you know those symptoms as well while you're screening. So I have also included the CDPH's screening questionnaire as well, if you click on that link. And because so many people with COVID-19 have no symptoms as well, it's essential that you ensure physical distancing, good infection control, and that you pick up infection early. If anybody has new symptoms but does not need hospital care, please isolate them and notify the Lawndale mobile testing unit by calling that number at any time. Just some guidance for that. So the mobile testing team will be deployed to the unit on the same day or the following day, depending on the time of the notification and the testing team's availability. and make sure that you keep that resident isolated until the testing team arrives. And if the resident has a fever or an onset of a cough or shortness of breath, but still test negative by the rapid test, a new confirmatory test may be needed, but that individuals should stay isolated until those confirmatory test results are back. And individuals with confirmed COVID-19 should be referred to the city's support isolation facilities. Again, please click on the link for more details, and make sure that you report any new cases for residents and staff members to CDPH through the online case report form or by emailing Cassandra. I've included her email there. And the CDCIs, either me or Andrew, will be following up to then collect more information regarding the cases, and we will help to schedule testing for the facility depending on the exposure. Next slide, please. Okay, more reminders. The housing providers should be following the CDPH's guidelines for commercial buildings in their offices and the guidance for residential buildings in the client homes. Again, please click on the hyperlink to access these guidelines. Here are some more reminders to reduce the spread of COVID-19 in your facility. Prevent spread among staff and residents by properly wearing your masks and practicing good hand hygiene and environmental hygiene. Also ensure that a ready supply of hand sanitizer is available in all shared spaces. Establish smaller resident social groups for sleeping, eating, and other activities, and keep these groups separated from each other for cohorting. And practice physical distancing by rotating access to the common areas to smaller groups, and keep beds 6 feet apart or add physical barriers in between them. And for shelter providers, make sure that all of your staff members are aware of the latest CDPH shelter guidelines available through that link. And also the influenza vaccination for staff and residents can be used to reduce the spread of respiratory illness in the winter months, and may limit the additional COVID morbidity and mortality in the event of multiple infections in the shelters. So we recommend that everyone take their flu vaccination as early as possible. And those are the updates from the CDPH end. And I want to hand over to Maura, who will provide more updates from the DFSS.
Hi, good afternoon. This is Maura McCauley from the Chicago Department of Family and Support Services. Thank you for all of those updates. So today, just wanted to continue to share that DFSS is continuing to support a decompressed shelter system along with all of the support that our partners at CDPH are providing. So just a reminder that all of our shelters are continuing to operate at their reduced social distancing bed capacity to support social distancing and all of the preventative measures that we've been talking about for the last several months. An update on our alternate shelters: we are continuing to support this decompression by finding alternate sites to house the beds that have had to be moved out of our funded shelter partners. So over the last month, we have worked with many city partners and many homeless service provider partners to consolidate the several facilities that we were operating in the early phases of COVID into 2 city leased facilities, which are located at Calumet High School and Young Women's Leadership Academy. So Young Women's Leadership Academy is currently serving single women and will be able to serve families. And then Calumet High School right now is a shelter for single men, and it has the ability to flex up for additional beds for men and women. We will continue, our plan right now is to continue this decompression and social distancing bed capacity at least through March of 2021, which is the guidance that we've received from CDPH. So we will continue to evaluate this with all of you and CDPH and continue our contingency planning based on how things evolve with the pandemic. Our overnight shelters are continuing to serve adults 24/7. And as a reminder that we've shared in the past, that the youth overnight shelters went back to overnight hours around the middle of the summer, and we're continuing to monitor that with both CDPH and the youth providers to understand if we need to make a change there. We are heading into winter and talking about winter planning and the ability, the reality that all of us will be indoors quite a bit more. And it's also a time that we typically see more people experiencing homelessness come inside to the shelter system. So again, we want to make sure that we're focusing on things like flu shots, continuing to work on opportunities for facility improvements like bed dividers or sneeze guards that many of our providers are investigating or have already put into place to just make the facilities safer as it relates to preventing the transmission of the flu or COVID or really any virus. And then just really thinking about what are best practices to keep people engaged and inside during the cold weather. So I think this will be an ongoing conversation as we head into winter. Next slide. And then continuing to provide the comprehensive outreach response with our DFSS HOP team and many nonprofit outreach organizations. The testing strategy that we have been working on with CDPH and our partners at their testing partners at a number of medical facilities is now focusing on the larger encampments. And then the DFSS mobile unit is fortunate to have a physician from Heartland Alliance Health on board 3 days a week, and they're offering testing through that mobile unit as well on a recurring basis at the encampment sites that they visit. We're continuing our citywide canvassing with our outreach delegates and focusing on the preventative pieces, like making sure that folks have access to PPE, sanitizers. We will continue to maintain the porta potties and hand washing stations, and we still are providing outreach during day and overnight hours. And again, we'll be also partnering with our outreach and drop-in partners to talk about winter planning and thinking about warming centers and warming spaces and what that looks like with COVID, similar to what happened in the summer with cooling center provisions for heat emergencies. Next slide. So I think Chicago has received a significant amount of CARES Act funding. Back in June, the City Council approved a number of CARES Act funding plans that involved many human services, including homelessness, which we have shared out in the past. This summer, HUD announced that Chicago received an additional round of the Emergency Solutions Grant CARES Act funding that totaled $30 million, $30.5 million, and DFSS and the DFSS worked in close coordination with the COC and the COC's system funding group. We received recommendations that were kind of vetted through the COC lines of work and came through the system funding group, and we're able to have kind of a robust conversation about what the COC partners viewed the needs around for this round of funding. We also did things like surveying our shelter partners to understand how you all have been responding within your shelters, and things that you do have access to and didn't have access to, and things that you were thinking about as we thought about our funding recommendations. So today I'm just going to provide a very high level update about this breakdown, but want to remind you that this is on top of the additional round. So we will pull together a comprehensive look of right now all of the CARES Act funding that's dedicated to homelessness to share out some more specifics. But in this round, we are allocating more than $18 million for rapid rehousing, this will help support the expedited housing initiative that the COC is embarking on. We are supporting $5.5 million for shelters, outreach, and drop-in centers. This will support the shelter decompression. So this is a combination of supporting those alternate beds that have moved out of our traditional shelter providers, as well as providing extra support to our current shelter delegates, drop-in centers and outreach programs. We've added an additional $4.8 million into emergency rental assistance. This is all direct financial assistance because our earlier CARES Act funding is helping to support the programming and administrative sides. And then we are also wanting to kind of test a concept that the system funding group and some of the other lines of work have really been conceptualizing in shelter diversion, and this will also be paired with some additional funding from a past from the first round of CARES Act funding, and then of course really needing to bolster the data collection and data infrastructure of our system as we increase our service provision and funding so dramatically in the next 2 years by supporting HMIS. So again, we will have more to share on this. HUD will, the Office of Budget and Management will be posting a substantial amendment that kind of announces this breakdown to the broader community in the next day or two. So look out for that. And that's it for me.
Great, thanks. And I think we just had one question that came up during Divya's presentation. So either Divya or Isaac, I'm not sure if you could answer it, but someone asked, is LCHC able to do rapid tests on weekends as well as weekdays? Is that something you can answer on the webinar?
Let me check back with the team and I'll get back with the answer.
Great. Thanks. And Maura, there's one question that Laura submitted in the chat that we might be able to we probably won't be able to address now, but we can just say it verbally, and if we need to come back with an answer next time, we could do that. She asked, can you speak to how the outreach and shelter diversion areas will support families with children?
Yes. So the outreach and drop-in centers will support, the outreach funding is really supporting things like PPE, hazard pay, and staffing. But I think for diversion, yes, there will be, I think this is definitely something to come back to, but this is the high level concept is really thinking about individuals and families as they are literally entering the front door of the shelter system and working with them to get them back into housing within 14 days. So it will work with families as well as single adults, and we'll be, I think, doing some planning together with our COC partners on that as well. So more to come.
Great. And then Isaac from CDPH posted in the chat, I think just to organizers, so I can resend it to everybody, but they said if someone is sick outside of office hours, they should be referred to a hospital for assessment or testing. If they're not unwell and can be isolated on site, they could be isolated on site until testing is available during office hours. Another question, Divya, for CDPH, will CDPH be offering flu shots on site for congregate settings or housing programs?
Right now, I am not aware of that. I know there was like a flu shot for the employees, but I'm in contact with the rest of the team to kind of know about the new flu shot guidelines. So hopefully I'll be able to present on that in the next webinar.
Great. And then someone's asking when information will come out about the rental assistance program, which is actually a really nice segue to talk about the Expedited Housing Initiative. So I'll share some updates, which at the end of the presentation will include information about some subcontracting opportunities and what's already been done and what is coming down the pike. So as part of the Expedited Housing Initiative, All Chicago worked closely with DFSS and CDPH and many partners to kind of test some of the concepts and components of the Expedited Housing Initiative at Hotel 166. So I'm just going to give a quick update because that hotel has closed and we really want to celebrate the work that has gone on to help people really isolate and stay safe and healthy. And then most of them moved on to a permanent housing opportunity. So just as a reminder, Hotel 166 was utilized as a shield hotel for homeless individuals at high risk of COVID-19 that were identified by CDPH and DFSS. Lawndale Christian Health Center provided on-site care and services. All Chicago conducted 3 accelerated moving events, which I'll remind people what those are on a subsequent slide. So we did 3 AMEs at Hotel 166 starting on June 9th. And then towards the end, we really stepped up our efforts to sort of house even more people than we originally had said we were going to through the accelerated moving events to try to make sure that everybody, or as many people as possible, could get into a permanent housing option. And so you can see here that there's 57% of those that were at Hotel 166 that are now in a permanent housing location, which is really amazing. And then there's 7%, a few people who are either like really close, like tomorrow they're about to move in, or might just need another week. And those people are staying at a temporary hotel while we're working with the housing system navigator and the permanent supportive housing provider to get them housed. So a really high number of people left Hotel 166 and were able to move into housing where they can now shield on their own in their own unit and have a place to live. So it's something to celebrate. And we obviously couldn't have done it without all of our partners. So in addition to DFSS and CDPH, who really led this effort, we worked really closely with a lot of our rapid rehousing partners, a lot of our housing system navigation partners, and CSH as a co-lead in many ways, Lawndale Christian Health Center, Chicago Furniture Bank, and all of the other agencies on here had a significant role to play in helping make sure all of those people got housed very quickly. So just a huge thank you and a shout out to everybody who sort of touched this initiative. And if your agency is not up here yet, that's okay, because we are gonna embark on an effort now with this funding that Maura just talked about as a continuum of care to continue housing people at shelters and encampments. And so there is a lot of opportunity over the next couple of years to house more people more quickly than ever before, which is the goal of the Expedited Housing Initiative. So this number of housing 1,250 people in the next 9 to 12 months will change because there's new allocation of funding coming. So the next time we come together, we should have an updated goal here, but it's going to be a lot of people, and it's really hopefully going to put a dent in our homeless population. Though we know the economic impact of COVID will likely, we'll see an influx of new people coming into our homeless system, but at least we'll be able to kind of move some of the people that have already been experiencing homelessness on with the CARES Act funding. The other goal of the Expedited Housing Initiative is to reduce the time that we're housing people from 80 days, which is what it is currently, to 30 days or less, and then adopt any lessons learned from EHI so that we can just move more quickly as a continuum of care and reduce barriers to getting people housed. So you guys are used to seeing these components, but I like to show them because it's always good to just remind ourselves and stay consistent about how we're all understanding the Expedited Housing Initiative. Today, I'm going to talk a little bit about the Chicago Rents program. We've spent subsequent webinar presentations talking about what is an accelerated moving event, but just a reminder, those are hyper-focused move-in weeks where we do virtual unit viewings. We help get everybody all of the things that they need to select furniture and really be primed and ready to move into the unit either the next day or in 2 days or 3 days, however long it might take, but we're really trying to truncate the time that it takes to get everybody's documentation together. And then the connections to housing and services are going to be those subcontracting opportunities, which we'll talk about. And then we have a lot of system and provider accountability. You can read more about that on our website, but we've covered those quite a bit on prior webinars. So just a few slides about the Chicago Rents program. So this is a new initiative that All Chicago is doing for the continuum of care to recruit and support landlord partners in renting their own units to households experiencing homelessness. So it's going to support the Expedited Housing Initiative. And we developed the program in conjunction and with a lot of feedback from our system-wide landlord engagement work group, otherwise known as SLU, and other partners in the community. And the Chicago Rents program really focuses on engaging landlords and identifying units. So we're doing a lot of the heavy lifting that sometimes rapid rehousing case managers would have to do in the past. And I know a lot of PSH scattered site programs do a lot of this work too. And so we're starting with EHI to really do the unit identification and landlord engagement for those units. And by front loading a lot of that, we believe that we can hopefully make the process move faster for people. So we vet the unit by completing a virtual inspection. We help the tenant view the unit and then select furniture. So this is also part of the Chicago Rents program. We help with lease signing. We help coordinate the furniture delivery. And then we're mostly coordinating move-in through our housing system navigators or housing liaisons, which are part of the Expedited Housing program as well. So there are what we hope will be a lot of benefits for the continuum of care when we sort of get this program fully operational. It's starting now, but the benefits for the COC are that it ensures units are readily available and hopefully facilitates faster move-in times. By vetting units before they're offered to participants, we're hoping to streamline that move-in process. We are hoping that it centralizes and deduplicates landlord engagement work across many different agencies and creates a unified landlord-facing voice for the continuum of care. And for landlords, we like to share with them that what we bring to the table is timely rental payments, financial incentives to hold empty units. We can fill units quickly to reduce vacancies, which is always a selling point. There's tenant case management attached to the person going into the unit, which is another great selling point. We're trying to help reduce documentation, and then we have a landlord risk mitigation fund. So Mayor Lightfoot recently released a letter urging landlords to become involved, and then there's also been some press today. And so we encourage you all to, if you know of landlords and want to help us connect, please do that. We have a landlord survey, which is the first step to landlords getting involved, or they can email us at chicagorents@allchicago.org. So I know a lot of providers have extensive landlord lists, but you've worked really hard for those. And so we understand that sort of giving up lists can be difficult, but we just would encourage you to think about if you're able to share landlord contacts with us, and we'd be more than happy to take them. Okay, I don't see any questions about the Chicago Rents program. So let's move on to coordinated entry, and I'm gonna turn it over to Stephanie.
Thank you so much.
Hey, Stephanie Seidman, what time is it?
Karen Moore, showtime.
No, seriously, what time is it?
Well, it's actually time for the crisis response providers to please tune in.
What do you mean? They're already tuned in. They've been listening this entire time on the edge of their seats.
That's a true story, and it's a really good thing because staff at shelters, drop-in centers, and outreach programs really are the backbone and the superheroes that are connecting people to housing. And if we can go to that next slide.
How do they do that?
So much. Well, Carrie, I'm really glad that you asked. The idea is that crisis response providers identify people who are at high risk of COVID-19 complications and then go ahead and share that through HMIS. And if you can go to the next slide. So really just two parts. The first is identifying the population, And the idea is that people who are at high risk for COVID complications are being prioritized for housing. But it takes crisis response providers to understand who fits into that criteria. It's a couple of options. It could be people are at high risk because of their age, such as they're 60 or above, or families with a baby who's 1 year old or younger. Could be because someone in the household is currently pregnant. If any of those are true, then the household is high risk, full stop. No need to ask any other questions. If households don't meet those criteria, then it's a question of understanding if they meet the high risk category because of a medical condition. And so there's an instruction page, and I believe a link to it will be in the chat that walks you through this. But the main idea is that we're asking crisis response providers to read the whole list of conditions and then ask if any of those apply. There's additional conditions to read out loud if the family has a child. So it's not HIV, long drawn out pause to see if they have it, but hey, here's a list of conditions. Need to know if any one of these apply to you. And then if so, they would be high risk. If you can go to the next slide. The idea is that once people have been identified, that information will reach the Catholic Charities matching team to match to housing, because you'll enter it into HMIS. So what you're seeing is a screenshot. If you open HMIS to any client you work with, at the very bottom of their summary tab is this COVID-19 high risk indicator question. And so it does give a URL for conditions. It'll be even easier if you print out the instruction guide that lists all of the potential conditions that can make a household at risk. And then if the answer is yes, it's simply a yes or no box. That's why it's not important to know if they meet high risk for multiple reasons. They do or they don't. If they do, you would go to this checkbox and check yes. And that's what there is to know.
Hey, Stephanie, this sounds really important. When should people be doing this?
I mean, right about now would be amazing. So we're asking, to do as much as you can in the next few weeks. And also there is no deadline because of course people can come into the homeless system at any time and this can be updated at any time. The idea about trying to get a move on is that as people are updated as high risk, they can be matched to housing. This data can also influence understanding where there are large numbers of high risk folk to connect with accelerated moving events. So it's really an ongoing process, but now is the right time to get started. And then if you go to that last slide, if you have any questions, if anyone listening has any questions, please feel free to reach out anytime. That's my email. You could put questions in the chat now. Later, that's the help desk line. And the last thing Carrie and I want to leave you with is that Coordinated Entry will have our third quarterly check-in coming up September 23rd at 1 o'clock. We'll be featuring the new racial equity demo and how Coordinated Entry in Chicago is involved. All of the exciting work that's been happening within work groups ranging from domestic violence and human trafficking to acuity to assessments to transfers, as well as a little more information around what we are doing to connect high-risk folk to housing. So please, please, please join us if you can, and invite everyone you know to as well. And then that's all there is to it, Carrie. Thanks so much.
Thank you.
All right.
Thanks, you too. There is one question. Someone asked, is there a way to run a report of people at my agency who haven't yet been assessed for being high risk?
I think that question might be for HMIS. So the best that I could offer is that once next week we have a report that shows who is high risk, we're happy to show you that side of it from your agency, right? I think the only way to know, oh, I'm so sorry. As I'm speaking, I'm understanding the question. You're saying who hasn't been assessed, as in who hasn't been assessed for Coordinated Entry, and not who doesn't have a high risk flag. I apologize. Yes, yes, yes. We can help you with that. there's an unassessed report. The easiest thing to do really would be to email helpdesk@allchicago.org or HMIS@allchicago.org if you need help running that report.
Great, thanks, Stephanie. So just to clarify, it seems like there is a way to run a report for those who haven't yet, or to show who has or hasn't been assessed for coordinated entry, but maybe not yet with high risk in HMIS. Is that a good way to summarize?
I think for the moment that's perfect, but you know, this is a terrific question that deserves a better answer than that. So maybe we could leave it at that's the right answer for today, and we could respond as soon as possible with any updated information.
That sounds good. Okay, I don't see other questions yet. So this is the slide I referenced earlier about subcontracting opportunities. So as part of the Expedited Housing Initiative, All Chicago is going, or we're anticipating at some point, subcontracting with agencies for housing liaisons that are really going to be the ones going on site for the accelerated moving events, to do that heavy lift of getting all of the documentation in order and helping people choose a unit. So we anticipate subcontracting with some agencies about that. We are hoping to expand our Chicago Rents program and connect with agencies that are also doing that work. We definitely, for sure, will be issuing a request for applications for rapid rehousing. So to the earlier question of where do we find out about the rental assistance program, the rental assistance program is going to go towards Expedited Housing Initiative rapid rehousing. So you can read more about that on our website, and I think we don't have a timeline yet for when the RFA is going to go out, but it probably will go out in the next month or two. So stay tuned for that. We'll make sure to announce it at this webinar and send it out pretty broadly throughout the COC so that everyone has a chance to know about it. And then we're also hoping to carve out some funding for SOAR and then hopefully employment and income as well. So more to come on that. We'll keep making sure it's part of these webinars. So someone just asked a question about the request for applications for rapid rehousing. It's going to go out to all providers. So we ran a request for information. We can go back for a second. We ran a request for information process, and the goal of that request for information was really to determine whether there was enough interest in the community to then garner the need for a full RFA. And while we weren't clear that there's a lot of interest in the other programs, we are definitely clear that there was so much interest in rapid rehousing that we have to run a full RFA for the community. So we're planning to release the RFA to anybody in the continuum who wants to apply, whether they showed interest before or are now just finding out about the opportunity. So it will go broadly and be open to all agencies. Great, so just a couple of announcements. So we've been talking a little bit about the census on these webinars, and time is running out. So make sure, I think the key message is that make sure you get counted and make sure your clients get counted. So housing providers, you can help those that are in your program respond today, so they can do this online. If they're not sure whether they responded, there's guidance for how to sort of handle that, but just go to this, you can click this link and it'll walk you through everything. If you even take the survey, it's like, do you know that you responded before? If you're unsure, click here. So the census has built in ways to sort of account for double counting and things like that. So help make sure that your clients get counted by directing them to that website if they haven't already been counted. And then there's also resources for shelter and transitional housing providers. So these links will be live when we send out the PDF, but especially reference the how the 2020 census counts people experiencing homelessness for more information. And another initiative that the National Alliance to End Homelessness just launched, a campaign called Everyone Votes. It's an initiative to ensure that people who are experiencing homelessness are registered to vote and are able to exercise their right to vote. There's a toolkit there's sort of like a lot of guidance about how to develop a plan, how to help people get registered to vote, and then how to get the vote out. So just wanted to flag that for everyone. Maybe something that someone in your agency feels passionate about and wants to kind of be the point person or the leader for doing this at your agency. And there's a toolkit, and you can learn more on the National Alliance to End Homelessness's website. I also wanted to just share that the Continuum of Care Board had a meeting in August 19th. I don't know how we typically report out to the community about those meeting results, and I'm not sure if people really care too much, but I do feel like it's important for people to know that there is a Continuum of Care Board that helps set the COC's strategic direction. And so I wanted to encourage you all to know that there are minutes and you can attend the meetings. They're open, and now that they're virtual, it's as simple as joining a 90-minute webinar and listening in. And you can do that by visiting our website. There's a Continuum of Care page, and you can look at the calendar to see when the next board meeting is. They're typically on the even months, the third Wednesday of the month in the morning from 9:30 to 11. So we had one in August, and the decisions that came out of that were to approve the collaborative applicant MOU between All Chicago and the COC board, and now that will go to the full COC for a vote. We created an ad hoc racial equity group to determine the COC's plan to address racial inequities, and that group is just board members right now, but will likely lead to an expansion of that work that will be really embedded throughout the continuum of care. The board decided to reconvene the Unified Funding Agency to discuss a reallocation policy for HUD COC unspent funding. So we typically have on average $3 million of HUD funding that doesn't get spent, and the board wants to look at how we can address that. And then they're also convening the ad hoc ranking policies committee to determine ranking policies for HUD continuum of care projects in case there is a 2020 HUD NOFA process. Right now, there is no guidance on whether there will be a process, except for a note that HUD is looking into alternatives. I'm just going to pause for a second to see if there are other questions. Okay, I think we're okay to keep going. So as I mentioned, regarding a HUD Continuum of Care NOFA update, and this is really only applicable if your agency receives HUD Continuum of Care funding, so it probably won't be applicable for everyone on the call, but the National Alliance is advocating that the NOFA be canceled, and instead they just award 2020 funding to the 2019 grantees at the same level. There's legislation proposed about this, but it's kind of caught up in between the Senate and Congress right now. So HUD has also publicly stated that they're exploring alternative approaches to distributing program funds, but we did start at All Chicago the community's local evaluation process before COVID, and we're preparing to run an abbreviated version of an evaluation process and a ranking process in case it's required. There is a copy if you want to really get into the weeds of what the NOFA contingency plan entails. You can see a copy of that in the August 19th, 2020 Continuum of Care Board of Director packet on our website. If you have questions, you can always direct them to us at cocprograms@allchicago.org. And then there's a lot of action happening in the COC. So we wanted to make you aware of a save the date opportunity. The all COC membership meeting, the first one for this year, will be held virtually Wednesday, October 28th from 1 to 2:30, pending the executive committee approval of that date. But we're pretty sure that that one will be okay. So we'll send a formal invite, and membership dues reminders are coming soon. There's a couple of anticipated voting items, the COC charter, which is open for public comment right now. If we can finalize it and bring it to that meeting, it may be up for a vote, but for sure we'll be asking the Continuum of Care, which is made up of all of agencies, not just HUD COC funded ones, but we'll be asking everybody to vote on the collaborative applicant MOU between the COC board and All Chicago. That is the grant that All Chicago receives to do work on behalf of the Continuum of Care. So it's an important one. If you have other topics that you want to see us cover in the All COC membership meeting, please submit those as a question in the questions pane, and then you can also email them to us or ask us questions. And speaking of the charter, the Board Affairs Committee and a subcommittee of the Chicago Continuum of Care Board are proposing a complete revision of the COC governance charter. And the reason I say it's a complete revision is to encourage you all to read it. It is not as simple as sort of like crossing out a few words. It really is a complete rewrite, but there is a pretty comprehensive summary of what's changed on our website. And there's also a webinar you can listen to sort of remind you about what the COC is and what the charter does, so that you can be a little bit educated before you dive into the charter. But we are hoping that, I think right now only 7 people have submitted comments. I would love to see that number be 50 or more. And so it's really important that everybody look at the charter, submit comments, even if it's a no comment, looks great. We would be really pleased if more people could really engage and get to know the charter, because it's one of the more important documents that helps us govern our homeless system. And then I think we're getting to the last announcement. This one is just a repeat from last time in case you missed it, but we have a temporary dashboard up on our website with some basic data for the community, because the Chicago Dashboard to End Homelessness was temporarily removed from our website while we rebuild it, but we wanted to add something onto the website. So you can check that out. And then also we've published a data dictionary on the website so that you can understand how we're analyzing data for these lists, which might be helpful to some of you who are really into data. And then lastly, please make sure that these communications are circulated to all relevant stakeholders in your organization so they have the latest information. We've been doing a lot of thinking at All Chicago about our role in helping make sure information is communicated at all levels throughout the COC. And we do take that very seriously, but we can only communicate to the people that choose to engage with us. And it's really now your responsibility to be an ambassador for the information you've learned here to help make sure it gets spread throughout your organization, whether that's passing on these slides once they're published or sending the 2 notes that you took during the meeting on to the people that need to hear it. But please make sure that you help us carry on this message since you were able to participate today. We will post the slides and a recording of this webinar on our All Chicago's website on Monday. If you have any information that you feel like DFSS would need to know, some examples of those items are on here. Please reach out to the DFSS-homeless email address that you see here. And then by now everybody should have our questions email memorized, cocprograms@allchicago.org. And I don't see any other questions in the chat. But I'll give it just 1 minute. I'll stay on for 1 minute to see if maybe some people are typing some things, because I know we went through a lot of announcements at the end pretty quickly. But if you don't have a question and you want to log off, you can go ahead and do that. And thank you so much, and we'll see you next time.